So welcome to, I believe this is our fourth health brief that we have given through MFS US in conjunction with CDLS Washington and today NORAD as well. So we're really pleased to have Captain Sean Goodfellow with us as well as Master Seaman Lachlan McDonald. And I'm going to go ahead and turn it over to Sean, who is going to do a quick introduction of a counterpart of his at the NORAD location as well. So Sean, I'm going to go ahead and turn it over to you now.
Hi, everybody. I got surprised today and found out Lieutenant Colonel J. O'Brien is going to be joining us. For the most part, Lachlan and myself do most of the administration, as well as there's a doctor in Washington, Lieutenant, who helps us with, who handles most of the medical admin. But Lieutenant Colonel A.J. O'Brien, she's taken it upon herself to kind of be a main point of contact. And ma'am, you can probably speak better to yourself at NORAD.
What, can I just hear it on the speaker?
What's that?
Sorry, I just had to mute somebody.
Oh, sorry.
Okay.
So I don't know if AJ, if you're online right now, if you just want to do a quick brief, kind of just tell what your role is and how you help out with the NORAD folks.
Thanks, Sean. Can everybody hear me? So I am a Health Services Operations Officer, and I do work here at NORAD as a medical liaison. My primary job is planning. However, there have been a lot of instances where there's been a lot of healthcare issues here in Colorado Springs. So I've been trying to address some of those issues at the VCDS level, as well as the Deputy Commander of NORAD, General Coates. It's on his list of to-dos is to try and make things better here from an outcome perspective. So he has me kind of gathering some of the research of all of the issues that we're having at our different bases across the U.S. and trying to push that forward through the VCDS office. So that's kind of what I'm doing and why I'm sitting in on the WebEx today, just to see how things are managed and to make sure that we're on the same track and we're all communicating together. Thanks.
Thank you, ma'am, for that. You'll notice anybody who's had this briefing in the past, it's changed a fair bit from what you may have seen even 6 months ago. Some of the feedback we got was that it was almost a little too overwhelming. There was too much information. People didn't know what applied to them and what didn't, so they left the presentation sometimes more confused than they began. We've trimmed it down quite a bit, trying to usually tailor it to the audience, although since this is across the U.S., we made it fairly generic. But the one caveat that we want to say basically is if you have any questions, because we might have omitted something that applies to you in particular, all our contact information is included, and often a 5-minute phone conversation with somebody on the team will normally kind of sort you out. We've divided up the presentation into 2 main parts. We're going to talk mainly about delivery to some of a lot of the service members themselves, just because some of that has changed since people have come down here to the States. But what normally interests a lot of the people, obviously, is dependent health care, because that's changed significantly from what we're used to, whatever province we come from in Canada. So I'm going to hand over to Lachlan McDonald. He's going to talk briefly about how healthcare works for the service member here, and then I'll kick off after that and talk a little bit about healthcare for the dependents, which I'm sure most of you that's why you're online here. There's sometimes a little bit of overlap. Just try and keep in mind what particular part you're thinking of, like whether you're thinking about getting healthcare for yourself, healthcare for the service member, healthcare for a child, and then see what applies to you. And if there's ever any confusion or questions, please feel free to raise your hand, and hopefully we can sort you out there. So at this point, I'm going to hand over to Master Seaman McDonald, and he's just going to tell you who's who in the zoo and power through the military part of it, and then we'll get to what I'm sure most of you are interested in, that's dependent care.
All right, good afternoon, everybody. I hope you can all hear me just fine. So here we have a list of the medical team. We'll start off with Lieutenant Colonel Andrew Curry, and he's the Health Services Attaché here in the United States. So he's kind of like liaison for the Surgeon General. So he meets the Surgeon Generals and their attachés here in the United States and does a lot of policy work. So the main doctor that looks over everybody's files here is Lieutenant Commander Dan Milner, and he's the Canadian Forces Medical Liaison Officer. So he looks after your screenings and your PHAs, things like that. He'll end up reviewing those files. He's kind of like a base surgeon or your wing surgeon, depending on where you are, and yeah, he'll look over your categories, things like that. And we have Captain Sean Goodfellow. He looks after the finance side of everything, and he's the rock star for all the dependents. As he's the one that will answer most of your questions and be of most use for the dependents. Then there's myself and Master Seaman Lachlan McDonald, and Mrs. Christine Perot. We deal with the administration side, so getting your medical files from you and into the electronic health system. It's something that dependents don't do back in Canada, but here in the U.S. it's something that we can take care of for you. And the other thing we look after is getting files ready for the doctor and liaising between your health resources administrators and the doctor, just trying to keep everything as streamlined as possible for him so that we can get everything done for you and not miss anything in the process. So on here we have a couple websites. So if you're on the D1, there's the CDLS Washington website. And then we have the internet website, which has a little bit more information on it. But both of these websites, we added to them this summer, but we still have to get more information out to you. And we're aware of that, and we want to get as much to you as soon as possible. But the number here for the Canadian Forces Members Assistance Program is that's a huge asset for the Canadian military and their dependents, whether you're in Canada or the United States. This is a number that you can use in order to get social work appointments through a civilian system. So we don't get notified or anything like that. Your chain of command isn't notified whenever you go through them, but they're there, they're available, whether it be in an emergency or an urgent matter. And I'll go over that a little bit in a little bit more detail at the end of my presentation. So what I'm going to go over today, I'm going to go over how to access your medical care here in the United States. I'm going to start off first with members who will have access to Common Access cards but don't have them yet. Then I'll go into once you have your Common Access card, and then finally I'll cover those who won't have access to Common Access cards or military treatment facilities while here in the United States. So for those of you who will be getting Common Access cards but don't have one yet, I have a step-by-step process here for how to register for medical care. I do have a couple military treatment facilities here in the DC area listed, but I know that most of you are all across the United States, so just don't worry about that. But first thing you would do if you're going to have access to a Common Access card but don't have it yet is to go register for a temporary profile. And in order to do that, what you'll need is your passport and your posting message. Some bases might require that you bring your MPRR because your posting message might not have your dependents on it. So just bring your MPRR, and then that way they can match up how many people are posted with you with their actual names. So you'll take that those 2 documents or 3 documents to your patient administration, and you'll register for a temporary registration there, and then they'll give you a number. That way, if you need to have any care done before you get your Common Access card, that you don't have to worry about taking care of your registration in the event of an emergency. You can just go in and get your care done at that point. So once you have your Common Access card, you'll register with DEERS. It's typically done with the person who's giving you your Common Access card, but you can also call in and register afterwards. When you get your first historical file, like your first progress notes, there'll be like a little box on the bottom left-hand corner of your notes, and it'll say what you're registered as. And what you should see is a code called it's Kilo 72 NATO member. If you see that code, then you'll know that basically everything will be all right. You won't get any bills or anything like that while you're down here. If you do see a different code, the one that they often use is Kilo 74. That just might be an identifier that you have to go back to your patient registration and or your BCAC, which is your beneficiaries counselor administrative person. And anyway, they're going to be able to re-register you. You'll find that information for them at your patient registration. You just have to talk to their supervisor, and they'll get that changed for you so that you don't get any bills. And if you do receive any bills for your care as a military member, then take them to that patient registration and get them to sort that out. And I just want to reiterate that I'm talking just for members specifically. Sean will go over dependent care after myself. So for those of you who are going to have your Common Access card, in the event of an emergency, you don't have to actually go to the military treatment facility. It is preferred, but if you don't have the time, like if you're having a heart attack, then or if you're incapacitated or anything like that, obviously just you're going to go to you're going to go to the emergency room at a civilian hospital, and they'll submit a bill. They'll give you a bill. They'll send that to us at the embassy. So you can send that to the Plus Medical mailbox or to myself and Captain Sean Goodfellow. It's just the same as you would do back home. You would report. You'll do everything the same as you would back home with this. So you would report to the doc, let them know that you suffered an injury, and then submit your care through that as well. Your for the expenses. So again, just like back home, you'll go to the military treatment facility with that information as well, so that the U.S. Has a record of that happening, and then they can also do their assessment, and we can coordinate with them through you in order to get that information. If you are going to a civilian hospital in an emergency and you're able to talk to them, then you can use your Blue Cross card, so you don't have to worry about getting billed. So I'll quickly cover all of I'm sure this is going to be the larger part of the audience, is the people who are not eligible for their Common Access cards. So if you're here in the U.S. and you're a student or you're on a project, you still have access to medical care. It's just that for anything routine or non-emergency, you have to get pre-approval through the CFMLO. He's really quick at getting back to you, so you just send an email to either him or myself, and then he'll write back a quick email asking either for more information, or he'll say yes, approved, and that's your pre-approval. So then you can go and get the care that you need. For dental care, everything in the United States is the same as your medical care for members only, but you just have to go through Major Karen Holdren. She is the OUTCAN dental officer, so she's going to be the approval authority, and if there's anything that you think needs to be reviewed by a Canadian dentist, then please reach out to her. She can take phone calls, as well as there's the Plus OUTCAN dental cmp.dental.outcan@forces.gc.ca website or email, and she's pretty good to get back to those as quickly as she can. So unfortunately, our system and the United States system doesn't talk, whether it be the military or civilian side. So there is some there is some steps that you have to take as far as administration goes while here in the U.S. To make sure that your care is properly being recorded. So first things first is we'll go over your PHA, how often you have to have your medical up to date. So for those of you who are over 40, you have to complete your PHA and update your medical every 2 years. If you're air crew while you're in the United States, rather than doing it every single year, you only have to do it every 2 years. And for anybody under 40 and not air crew, it's every 5 years. And the process for going through that is that you'll complete your physical exam at a military treatment facility or from a civilian provider. If you're going to a civilian provider, please reach out to me beforehand, and I'll send you a checklist of things that you have to get done in order to have your PHA completed. And then you'll also have to do the questionnaire and send that to us. So if you can send your questionnaire with the progress notes from the provider that you go to, that'd be perfect. You do have to request those notes yourself. We can't reach out to them and get them. They have a lot of confidentiality laws that they are adhered to quite strictly, and the civilian providers won't even provide those progress notes to the military treatment facilities. So at the end of your appointment, whether you're on a base or you're a civilian provider, make sure that you get the physician's notes or the progress notes from that visit and send them to us so we can complete it. When you're doing a medical screening, the first thing to make sure you have done is your PHA. Make sure your medical is up to date before you start your screening. That's the biggest holdup, whether it be for promotion or cross-posting or extension, anything like that. Other than that, your screenings here are quite simple. So if you're getting cross-posted, just notify me and send me your DND 4064, and I'll send you all the information that you need. So your annexes, your Annex A, your Annex B, and your Annex C, and I'll set up the social work appointment for you. You won't have to do that here. You won't have to do like one with a U.S. provider. We'll also set up the medical and dental appointments for you if needed, and the immunizations we'll take care of as well. So all you have to do with any of those forms is just fill out your information and update us on any changes to your medical status, and we'll complete everything else. So it's not the same hectic, high-stress situation as it was in order to come down to the United States. So I have here again the Canadian Forces Members Assistance Program. The phone number is 1-800-268-7708. This is free and available to members and their dependents. So each time you have, medically we call them a complaint, but it's not necessarily a complaint. Anytime you call them, they'll set you up with up to 8 sessions, and each complaint is would qualify you for 8 different sessions. So say if you have depression and anxiety, which typically go hand in hand, it would be 16 sessions rather than 8. They do marriage counseling. They do a wide array of different things, and they really go out of their way to set up the appointments for you to make everything as simple as possible for you. They're an amazing support unit. Oh, and they'll also try and set the appointment up for you with the provider of your language of choice. So if you're French, they'll try and set you up with a French provider. It is a lot tougher to find, so the wait times for those might be a bit longer, and then they'll take care of the billing directly. So you never see a bill for any of that. I really highly stress taking down that number and using it if you find yourself in a situation where you need that for you and your family. I'm actually just going to go back one slide here. And I just want to reiterate the importance of asking for your progress notes. So that's not just for a physical health examination. It's for any time that you visit a doctor or a medical institution here in the United States. Anytime you do that, send them in, go request the paperwork and send it in to us. And at the very end of your tour is often the easiest time to do this, especially at a military treatment facility. You can just go in to the health records department, ask for your medical file from the whole time that you're here, and then you can scan and send that to us or send it to us via mail. And I'll scan it into your system so that it has all your information. If it's something that you want to do for your dependents as well, again, when you come down, we create an electronic file for each of your dependents, and we can scan and save their stuff just in case any files or anything get lost while you're traveling or moving. And that's all I have for military care. Does anybody have any questions regarding military care in specific? All right, then. So I'm going to hand over to Sean, and he's going to carry on with the dependent care.
All right, I'm back online here. So one thing you might have noticed, Lachlan mentioned twice the CIFMAP program there. That was intentional that he put it in there twice. It's a good reminder that sometimes we feel fairly isolated while we're in the United States. People suddenly drop their dependents in a new country, and then they might be gone on exercises, whatever the case may be, and they're away a lot, and everybody kind of feels like they're left out in the cold. A lot of the programs that are available to us and our military members and their families back home in Canada are also available, and we just assume they aren't available down here in the States. I'd highly encourage people talk to MFS or local spouses, local families, find out what might be available for you. You might be surprised how much support we might have, and we just assume that it's not available to us. That mentioned, this slide just kind of transitions us from military care to dependent care, and you'll be able to see, depending on what your situation is, what your status is here on the left-hand side of this slide. You might have a CAC card, you might not have one, and basically, if you have a CAC card, there are 9 states where care is a little bit different. So if you can find yourself in this slide. So at the top you have no CAC card, or you might have a CAC card and you happen to be located in one of the 9 areas listed on the left there. And then further down you have a CAC card, but you're not in one of those states, you're in one of the remaining 41. And then basically what kind of care you're getting. So across the top, outpatient care, and that basically means your standard appointments that you have. Basically you weren't admitted into the hospital. And then we have for military facilities or civilian facilities, and then inpatient care the same, and then dental care. And basically this just kind of outlines who's paying for the care that you're tracking. So I'm not going to read through this slide because that would take a little bit of while, but I definitely refer you to it if you have questions. But if anything's confusing, definitely reach to our office and see if you're just confused on who should be paying for what. But essentially, when we're talking dependent care, you have 2 choices. Hopefully, so basically how I look at it is people find it a little confusing down here in the States, but what I'd like to say is basically we're given an additional option we didn't have back home. So I came from Trenton, Ontario, before being posted here. Getting a family physician for my spouse and my 2 children was next to impossible. Here, we're lucky enough that sometimes the dependents can get health care in the medical treatment facilities on base, which wasn't an option for us back home. So it's kind of a nice to have, but it's definitely not required. There are some plus sides to getting your treatment at the medical treatment facility. It saves you some admin hassles as long as you're registered properly. Like Lachlan was telling, sometimes you'll notice on your first appointment, you might not have that K-72, but once you get that sorted out with your BCAC, your beneficiary counselor and coordinator, everything's pretty smooth and you shouldn't see any bills, but that's for medical and not dental. But Lachlan and I, we can say for the military people, you're going to get your health care at the MTF because you're military and that's what you're told to do. Obviously, we can't order the dependents on where to get their health care, and if you choose to get it done at a civilian facility, that's definitely your choice. There might be many reasons to get that. done that way. It's closer to your house. You've been advised the doctor and the nurse practitioner there are a really good team, whatever it might be. So if you choose a civilian facility, that's definitely your choice. And your medical services would be claimed through the public service healthcare plan. Back home, that was Sun Life. That's Global Alliance down here, but basically it's just the administrator of the public service healthcare plan. Before spending money, I always advise that you make a decision based on proper information, and a lot of that information can come from Global Alliance themselves. I've never had them take more than 7 or 8 minutes to answer the phone. But what I suggest is when you're pressing 1 for English, 2 for French, all that stuff, make sure you pick the selection for comprehensive care, because Global Alliance is mainly a travel insurance company, so they're not totally used to this. But as long as you're speaking to somebody who knows the comprehensive care part, they'll give you proper information. Also there I have direct billing is encouraged. That's just to say it can save you from having to be out of pocket while you're waiting for Global Alliance to finalize a claim for you. Some providers have difficulty finding them in their system, and if you're ever having any trouble, you can always reach to me again, and I can hopefully give you the proper information you need to make direct billing an option. So medical.
Sean, Sean, can I interrupt for just a second?
Yeah, sure.
We have some questions in the chat, and some people
I'm not
are
seeing those, sorry.
No, that's okay. So, and if you're going to be getting to them, just let us. If I ask you the question and you're going to be getting them later on, that's okay. Just you can wait and get to them later on, but we just don't want to miss them.
Sure.
So, one of the questions is, how can we get a Blue Cross card for the military member?
So we should all the military members should have their Blue Cross card already, and we were given them when we joined or shortly after. But if you're having trouble getting it, there is a way to basically order a new card. I can give a link to that as well if the member is having trouble finding their Blue Cross card because they haven't needed to use that. But essentially, they would need their Blue Cross number. Even if they don't have the card, is their service number, but that leading letter is replaced with an M, as in Mike. So my service number starts with T38, but my Blue Cross insurance number would be M38, and then the rest of my service number.
Okay, and so basically, if they don't have it, reach out to you, and you can make sure that they have what they need to request it.
Yeah, there's a login portal that they can see. Basically, I can see all the prescriptions and stuff that I've gotten at Canadian clinics, and there's also an option on that portal to order a new card.
Okay, and then another question was, are electronic medical files required to be sent in any sort of protected format?
So we have to be a little bit flexible here. Normally, we would say it has to be sent protected, be encrypted, and if you have DWAN access, I definitely recommend it. You can send it to me. We only have a plus box. We don't have a plus box, but if you send it directly to myself, Lachlan, Dr. Milner, you can always send that encrypted. If you're not comfortable with it, you can always send it snail mail as well. But a lot of medical claims and things like that for ease of getting things done quickly, basically for the member and getting money back in their pocket. Sometimes they just send it unencrypted, unfortunately. So we have to be kind of flexible on that. If we really force the privacy measures, it could take a lot longer for people to get everything sorted out.
All right, another question was, if you have a referral from one of the MTFs to go off base, is it paid for by TRICARE or Alliance?
So are we talking dependents, or are we talking for the military member?
Nicole Dunn, you're the one who asked the question, so I'm just going to refer to you.
I'm talking for dependents.
Right.
Thank you.
There's been some confusion on this part, and to keep things basically as simple as possible,
Yep.
What I say is, first, when you register with the medical treatment facility, they have an option to fill out a other health information form with them, and that's where we can register our dependents' Global Alliance Public Service Healthcare Plan information. So when referred out, the Public Service Healthcare Plan Global Alliance would be billed. Sometimes some confusion can happen on that part. Somebody doesn't check the right file. So when possible, basically when the dependent goes to get care and is referred out, when they're talking to that outside provider, they're going to see TRICARE as the who referred them. It's best if we tell that provider, don't bill TRICARE, bill Public Service Healthcare Plan. It makes it much simpler because sometimes there has been some back and forth sometimes where Global Alliance says we're not a secondary insurer, and then it takes a little while longer for the member to get their money or the dependent to get their money back if they had to pay out of pocket. So yeah, put it through the Public Service Healthcare Plan.
Okay, perfect. Thank you very much.
There are a few more questions, but I think some of them might get answered as you keep going. So for those of you who haven't had the question answered, just give us a little bit of time, and then we'll come back around again in a few minutes. So go ahead and continue on.
Okay. So for our dependent care, there's the medical side of things and the dental side of things. Medically, like I mentioned, instead of being Sun Life down here, it's Global Alliance. But basically not too much else has changed other than the fact that you're getting, and I'll talk about the difference between comprehensive care and supplementary care on the next slide. But basically, instead of Sun Life, you use Global Alliance. Global Alliance is just the administrator down here, but it's all Public Service Healthcare Plan. So you still need to contact Sun Life, update your address, maybe your direct deposit information, stuff like that, and then Global Alliance will pull their information from it. Also, you can talk to them and just confirm that you actually do have comprehensive coverage versus the supplementary coverage. Not much has changed for dental, other than it's still done through Great West Life. The one thing Dr. Nick up there is trying to show you is prices can vary significantly down here in the States. So if you're only getting covered 90%, 80%, 50%, or there's lifetime maxes like $2,500 for orthodontics or something like that, that money might not go as far, or your 20% share of whatever the bill might be could be significantly larger, so it's worthwhile to do some shopping around. I was talking to somebody on one of the Air Force bases, and they said the Bro network here is very strong. I'd recommend engaging that, either a spouse network or fellow members, and just finding out where they're getting their care and why they chose that place, because a lot of places will try to help you out to make it more affordable, but not every provider would do that. So basically, everything's through Great West Life, so nothing's really changed there, but the price could vary significantly, so you want to take a look at that. This slide here just kind of depicts what the difference is between supplementary care and comprehensive care. So on the left, you'll see supplementary care, and you'll see that Sun Life up top. So mainly, I came from Ontario, so there's a picture of a OHIP card there. And the majority of my family's healthcare was provided through the province. And what wasn't covered, some prescriptions, whatever it might be, we claimed through Sun Life. The difference down here is we don't have that base level set up from the province, so everything is claimed through Global Alliance, whether it's direct billing or the member putting in a claim. So what will happen is basically that provincial share is covered by the federal government while you're here OCAN. So there might be some questions here about basically, so how do I go about claiming that comprehensive care? So the first thing I always say is before spending money, make sure you're informed. So confirm coverage. What you can do is you can always seek a predetermination of coverage through either Great West Life or Global Alliance, just to see how much of a certain type of procedure is going to be covered, and then how much you're going to have to be out of pocket or how much you're going to have to claim through our office. Always try to arrange direct billing if possible. It just saves you the headache of having to or float an amount on your credit card or whatever it might be. Assuming direct billing is not possible, a provider is going to give you a bill, and you're going to claim that bill through Global Alliance. Now, Global Alliance has limits on what they can cover. Baseline basically is they'll pay for about 3 times what a specific procedure would have cost in Ontario. and the rest they won't cover. So what happens is you put in a claim, and any claims you've put in before, you probably got an explanation of benefits explaining like, this was covered up to 80%, so here's your check back, and here's what you were on the hook for. An extra little part there that says an R70 amount, which basically says this procedure cost $100 back in Ontario. I know you spent $500, but we're only going to cover you up to 3 times that $100 it would cost in Ontario. Then you'd have an R70 amount of $200. That R70 amount can be sent to my office as a claim by the member on a general allowance claim, and then we would get you paid back. If it's going to be a significant dollar amount, usually $400 is the minimum, but it can be significantly more. You can always request in advance in order to pay the provider, get that receipt to make the claim to Global Alliance, and then just reconcile that claim through my office again. The only exception to R70 amounts, that amount that's 3 times what it costs in Ontario, is vaccinations. So Global Alliance treats the required immunizations as a prescription, which is only covered up to 80%, but it is required. So that 20% that Global Alliance didn't cover for a hepatitis A shot or a flu shot or whatever it might be, claim that 20% through my office as well. And that's the only exception to the R70 amount. So basically the R70 amount will get beyond that explanation of benefits with a proof of payment, and then a general allowance claim, and basically through Global Alliance for the main part of it, and then the additional part on that R70 code, you should be fully reimbursed. Dependent immunizations, the exception, and then through Great West Life, they have a similar letter. It's called a excess dental letter. And basically the same idea is they understand that things are more pricey down here, so what you would have paid, and hopefully the difference gets reimbursed through that letter. But again, I would definitely recommend shopping around when it comes to dental. Usually at this point, there's some questions. That's the case right now, Joanne. But
So yeah, so there are a few here. I'm going to go back into the chat, and if I miss anybody, just let me know. So one of the questions was, other than changing their address with Sun Life, do they need to do anything else special with Sun Life to ensure that they're receiving coverage while in the U.S.?
So as soon as you cross the border, the member should speak with the orderly room wherever they may be and ensure that they're set up for comprehensive care. The normal indicator will be on our pay statement at the beginning of the month, where it says $4 for public service healthcare plan. It should actually say like $4.01 or something like that, and that's usually the indicator that they're covered. Even if that paperwork, which can take 8 to 10 weeks, I'm told sometimes, and there has been hiccups where it's taken longer than that. Even if that paperwork takes some time, the member and their family is covered with comprehensive care when they cross the border. They might not be able to file those claims through Global Alliance. And if that's the case, where there's been people that while they're traveling, they're basically still homeless waiting for their stuff to show up, and they've had a significant medical incident where they required to pay out of pocket, that's where the advance can come into place until Global Alliance and their paperwork catches up.
Excellent. Another question is, how does a military spouse who accompanied the member and is LWOP access dental care? Would that be the same process?
Not exactly. So I'm going to actually, Lachlan's way better situated to answer that question, but the answer is they're still military. They're not on leave. They're on leave without pay, but as far as we're concerned, they're military. So I'm going to just hand you over to Lachlan. Basically, there's certain paperwork requirements like pre-approvals and stuff like that that are required. When it comes to paying for it, it's still Blue Cross or general allowance claim through myself, but the actual ins and outs about getting specific care beyond the ordinary, he can answer.
Hi, sorry, I didn't catch the question there.
It's when it's a military spouse who accompanies the member and is leave without pay. How do they access dental care? What's the process for them that's going to be different because they're still a member themselves?
So they'll still have the common access card for the military treatment facility. So they'll still be able to access the dental care there. And then they also have the Alcan dental officer, Major Karen Holdren, still going to have like kind of final say on the procedures that they can go through with. So if it is something complicated, then it's still something that they have to go through her in order to get that approval for.
Hi, can you hear me?
Hi, yes.
Hi, it's Major Chris Duncan. That was actually my question, and I got my wife. In terms of her accessing dental care, she doesn't have a CAT card because she's, as far as the U.S. is concerned, or U.S. Army is concerned, she is a spouse because she's not here on any sort of ITO or actual exchange or anything. So without a CAT card, that's what we're saying. How does she access dental care? Because there's no, it can't be through the military facilities here, and Blue Cross doesn't really cover that.
Okay, so I'll have to look into this one for you, and I'll get back to you. So, do you have D1 access, like for email?
Yeah, no, I'm not on D1 or anything. I can. I think we've got your contact info through here. I can flip you an email after.
Yeah, and I'll look into it and make sure I can get you the best possible answer, and then we'll go forward from there.
Thanks.
All right, thank you, sir.
Perfect. So I'm going to, Lachlan, I'll ask the question, and then if you feel like you can answer it, great. If not, you can hand it over to Sean. But the next question was, even though they have a DEERS card, and it says I have TRICARE, they can't be seen at the base because the base can't take new patients. So they've called a helpline, I think, trying to help find a provider, but their files say that they don't have coverage, so she hasn't been able to see a doctor. So what do they do when they have a DEERS card, they have everything they need, but the base provider can't see them? Can they go just to just out into the community then?
Sorry, this is Sean again. Are we talking military member, or are we talking dependent now with the DEERS card? We're talking dependent.
Looks like dependent.
Is that accurate?
I'm not seeing.
Okay. I'm going to assume dependent.
It's not. Yeah, me too.
Okay, I'm going to assume. So that's something we're running into a little bit. Not all of the medical treatment facilities are even seeing active duty American military families anymore. They've been sent out onto the economy as well. And when that's the situation, sometimes that happens for our families as well. What I want to remind everybody is that it is a nice to have that the medical treatment facilities allow our families to go there, but remember that that's something extra we didn't have back in Canada. We were often posted across the country and not able to get a family doctor, and it looks like we're kind of in that situation again sometimes. So that said, they should have insurance. They have, so they're gonna, if it's the military member, they have Blue Cross, and I can always, I often have to type up letters basically explaining to for some of the students down here that for their universities that they have health coverage covered by the Crown. And then the same applies for dependents. We've got Great West Life, and we have Global Alliance to cover.
Hi there, can you hear me?
Yeah.
Sorry, this was my question. My name's Dee, and yes, I'm a spouse. So what happened was I went to the went to the hospital with my husband, and he's been there with me many times, and we cannot get this sorted out. So they say, yes, I have TRICARE at the hospital. If the previous Canadians that were here, they had no problem because they took dependents at the hospital. But when they call this hotline and through, they give them our number, my husband's information, they say, no, I am not covered, and they cannot give me a provider. So then I can't see anybody outside the base. So I'm kind of in this loop, and I can't.
You haven't been able to give them your Global Alliance, your Sun Life information?
They say they want to see his orders, and unfortunately, yeah, they don't want that. They want to go through. They say I'm eligible for TRICARE at the base, and they keep telling people on the phone that, but they won't accept it. That they want proof of this TRICARE.
Again, this sounds like more of a I'll need to talk to you offline about
okay,
it.
okay, no
Yeah,
problem.
my general answer would be, even if you weren't, anyway, you should have coverage through the public service healthcare plan. It doesn't need to be TRICARE insurance to be insurance.
Okay.
So I'm not sure. I definitely sounds like a more in-depth conversation.
Okay, thank you.
And then just a clarification, we did have somebody who their daughter was seen at an MTF and was referred to an outside provider. But the outside provider actually used the TRICARE number on the CAC card. And so is that something that she should have to watch for? Like, is that going to come back at some point on her? She was never billed for it.
So that's a question I get sometimes, and the answer is maybe. I think the best thing we can do is be proactive, just to make sure. Sometimes it just goes through TRICARE, no problem. There might be a small copay or something. But the best thing we can do is make sure that other health insurance form is filled out, and then that we actually tell the provider, I know I have a TRICARE number and all that, but when I'm referred out, I would prefer that you use this insurance. And by this insurance, I mean Global Alliance through the Public Service Healthcare Plan. I haven't heard of anybody getting bit about it later on, but I think it would just be best to be proactive in this case.
Okay, any other questions before we allow him to move on? Okay, I think we're good, and there will be a time to ask questions at the end as well.
Great.
Go ahead, Sean.
So at this point, I just kind of, I'd like to say, like, obviously from some of the questions here, no person is in the exact same situation as others. Some of us come down with no dependents, some just a spouse, some children, some one child back in Canada or in university in the United States or something like that. We're all in different situations, and obviously we can't capture everything. And sometimes the policies aren't meant for those outliers, those of us in different situations. A little proactiveness on some people, some of our parts, like asking questions like, what should I do in this part, or am I covered for this part, can sometimes save a little bit of grief in the long run. But at the end of the day, our health coverage is covered in the United States. It's done significantly differently than we're used to back home. And the reason I include this slide is basically one situation that seems to rear its head fairly often is we'll have sometimes people will need to be put under through use the services of anesthetists for surgeries and whatnot. And down here in the States, things are done differently, and sometimes a nurse will do that service that Global Alliance only covers if a physician does. So what will happen is they'll get a significant bill from a hospital saying, your insurance didn't cover this, you're on the hook for $5,000 or $300, whatever they want to charge for it. And Global Alliance is saying, no, we won't cover it. And like I said before, I can only handle claims for the R70 amount. But what will happen is, in that case, there is a working group that sits in Ottawa once a month and goes through these different situations. Some of us might have dealt with working group B if we're trying to figure out dependent education, French immersion, Catholic school, stuff like that. But they handle a whole gambit of different things, and medical coverage for certain things is one of the things they handle. The headache is that you have a provider expecting payment now, and a working group in Ottawa that sits once a month and then asks you questions once a month can sometimes take a significant amount of time to get you approved and get you paid. So what will happen is you'll need an advance sometimes, and if we've seen the situation in our office enough times that we know that eventually it should get approved, we can usually give you an advance. But sometimes a little conversation with the provider saying, and usually this is sorted out through direct billing, they submit a plan to Global Alliance and you get your predetermination of benefits, and then Global Alliance is like, I see in your plan you're going to plan on using this type of provider to put the patient under. That won't be covered, and the hospital can change their plan to make sure that they get paid because that's in their best interest. So sometimes basically what I'm saying is things can go wrong. Usually we can get it sorted out in the end, but asking some questions up front can sometimes save yourselves a headache. So anytime there's questions, there's a reason we put our names up at the front of this slide deck, and to make sure, ask a question, and hopefully we can get you the answer before you really need the answer. Sometimes that'll help. So I've covered most of what I want to cover here. The main slides I would, I think Joanne, you said you're going to get the slides out to whoever asked for them, but the main slide there where Lachlan and I switch spots, that kind of you find yourself where you fit, whether you have a CAT card or you don't, or if you're in one of those 9 states. The main difference between those 9 states that are listed in the middle row of that slide is that under the reciprocal health care agreement we have with the United States, they'll also provide inpatient care for us and our dependents, whereas the other 41 states do not. So that's the main thing, but now Lachlan and I are definitely available for questions. I'm sure there's a few.
So feel free to, at this point, raise your hand if you would like to ask a question. You just have to make sure you unmute once you raise your hand so that you can ask. If you do have something that's very detailed and you actually need to have a conversation about it, you might want to reach out directly to Sean and he would be able to help you. Do we have any other questions at this time? Geneva?
Yeah, I'm not sure. I might just be a little bit confused. I obviously just arrived here, and I just want to reconfirm with the timings. Like, I understand how the insurance works for the dental, but I kept hearing that I would have to wait a certain time until I'm covered. I guess I'm just reconfirming that as soon as I have that card to go on the base and the address is changed and all that, as soon as that's good, I can go and see a dental provider?
So most of the families usually won't. Some bases are the exception, but for the most part, we shouldn't be getting dependent dental care on the MTF. There are a couple bases that'll fit you in because it's nice for them to get practice on younger patients and stuff like that, but that's usually the exception, not the rule. So essentially, not much has changed for dependent dental care as we've come down to the States. You still have your Great West Life information. If I remember correctly, it's basically, I think the insurance number for the Great West Life is usually the member's service number with a leading E as in echo. But basically not much has changed. You don't have to wait. Nothing's really changed. The only thing is that things are a little more pricey down here sometimes. So dental-wise, okay. Nothing's really changed for you since you came down.
Oh, okay. Yeah, sorry. That's basically what I meant. So I can receive medical as soon as I'm registered there, and I can receive dental as soon as I have that. Perfect. Thank you. That answers my question.
Perfect. Good.
Oh, we do have a question in the chat. When getting mammograms, are you supposed to ask what type of scan is being done? 3D imaging has become a bigger thing, and so is that covered?
That's definitely a question for Global Alliance. I don't know off the top of my head what level of, or maybe they cover, I'm not sure, maybe they partially cover certain types of scan, but that's one of these.
You'd want to call them directly then?
That predetermination for sure.
Okay. Somebody's asking about verifying the Global Alliance piece. Who would be the best contact for that?
So you can ask your orderly room. The member should have basically sent in. Often what happens is the person's losing orderly room back home in Canada will try to initiate this, but until we cross the border, they can't activate our comprehensive care. So as soon as you're clearing in, most orderly rooms are pretty good about handling this. But just confirm that they've put in the paperwork to get comprehensive care. But for my own situation, I called up Global Alliance anyway. Two reasons. One reason I called them up was basically so I kind of knew what the menu would sounded like. So when people asked me questions, I knew what they were talking about. But the other one was to confirm that my family also had comprehensive care, and they were able to answer that question for me. But sometimes they're a little slow. Like I said, sometimes it can take a few months before that gets sorted out on this end. But you can always ask for an advance if we're in a jam.
And so just to clarify for everyone too, in the after session email that everyone's going to be receiving, That's going to have a link to this recording, a link to the PowerPoint presentation, and we also provide the direct contact information for Global Alliance as well. So you are always welcome to reach out directly to Global Alliance to verify information as well.
And often they'll have a better answer, more in-depth answer than I will when it comes to the actual coverage under the Public Service Healthcare Plan.
Any other questions? I'm not seeing anything come up, so Sean, Lachlan, Anne, we just appreciate you all showing up. We appreciate the work that you're doing on behalf of our families. This is definitely one of the biggest struggles that our families have because it's such a different system in the United States than what we're used to in Canada. So we appreciate what you do, and thank you for taking the time to do this. Again, everyone, just watch your emails tomorrow for an email from me just giving you links to all the things that we talked about today, and it'll also be all on our social media pages as well tomorrow. So thank you everyone for joining.